Hi, my name is Kirk Hamilton, and this is the Staying Healthy Today show. I'm an author, health educator, and practicing physician assistant of 30 years in nutrition and integrative medicine. Today's show topic is heart failure, simple things you can do. I was kind of pushed to do this because I had a dear friend of mine be admitted to the hospital for heart failure who had classic risk factors. Type 2 diabetes for many years, hypertension, had past heart attacks, high cholesterol. Also, I came across this article that said heart failure hospitalizations jump after the holidays. Well, I guess that means if we take in more calories and we take in more junk calories, that's going to increase the risk of heart failure. So I want to go and give you some quick things that you can do for heart failure to help people. Number one is, people don't realize, but it's the number one hospitalization for adults over the age of 65. That's heart failure in the United States. About 5 million people in the United States currently struggle with heart failure, and about another 500,000 are diagnosed as new heart failure patients each year. So what happens in heart failure is the heart can't push blood back out, and there's a backup, and you kind of have the fluid go back in your lungs and you kind of drown. And there's two reasons, well, there's a bunch of reasons why, but two main reasons why. Either your heart muscle fills up, but it doesn't have the strength to push the blood out, or the heart walls are so stiff that it can't fill up to push enough blood out. So when you go to the hospital, what they're going to do, it's kind of like plumbing. They're going to give you a diuretic to get rid of the water, to get it out of your lungs. They're going to give you a drug to help make your heart squeeze harder usually. And usually they'll give you, or make sure you're on a high blood pressure medicine to lower your blood pressure. Now, if you're on a diuretic, that means you're usually taking potassium because you're peeing out that can cause arrhythmias if you don't have enough potassium on board. And then a lot of times they'll put you on a cholesterol lowering medicine. So the risk factors for heart failure are if you have heart disease, or called coronary artery disease, if you've had a heart attack, if you have irregular heartbeats, if you've had, or you can have an infection around your heart. Now, some people, high cholesterol is a secondary risk factor. You can have leaky valves or valves that are stiff. And then you can have what's called a cardiomyopathy, which is just an unknown reason why you have a weak heart. And there's certain drugs, like common drugs, that can aggravate heart failure, like the non-steroidal anti-inflammatory drugs like Motrin, Advil, all those kind of drugs can sometimes aggravate heart failure. So I want to give you a list of basic diet and supplement approaches that can really help, and you should do no matter what in a heart failure patient. Number one is, if you go on a plant-based diet that's unprocessed, micronutrient dense rich, that has been shown to reverse heart disease. And I'll give you the links to the resources to show that proof. So that's number one. Number two is some supplements. CoQ10 is the number one important one. Helps energy production in the heart muscle. In fact, almost all these nutrients are to improve energy squeezing production in the heart muscle. So CoQ10 or ubiquinol is a form I would choose. 400 to 900 milligrams a day. You want to get the blood level above 3.5 little ug/ml. Vitamin B1 many times gets peed out when you go on diuretics. It helps produce energy in the heart muscle. Magnesium is important for energy production and relaxing blood vessels. Ribose is a sugar that helps make ATP. Take about 5 grams 3 times a day. Carnitine, a little controversial. Some people believe it can aggravate heart disease down the road, but in the short term, it can be used to improve fatty acid metabolism in the heart and help it squeeze better, about 2,000 milligrams a day. Lipoic acid helps with, it's an antioxidant, it also helps with energy production in the heart muscle. And vitamin D has been shown at a low level to be an increased risk. So I'd have all my patients take at least 5,000 per day. Also have your doctor check your thyroid level. Sometimes T3, free T3 is low, and also testosterone levels are low. Now, if you get somebody who just doesn't want to do anything, doesn't believe in any of this, and they'll do one thing, then have them take ubiquinol, CoQ10, I would have them take 600 milligrams a day, very safe, 200 milligrams 3 times a day with food, it gets absorbed better, and that would be one simple thing you can do. So, as usual, all the summary of these little facts are put in the description below this YouTube with appropriate links. My name is Kirk Hamilton. Sign up for my newsletter, Kirk's Power Aging Tips. I'll talk to you soon. You have a great day.